If you're leading a medical practice, you know that a government shutdown isn't just some political headline. It's a direct threat to your bottom line. So today, we're not just going to talk about the problem. We're going to give you a strategic guide to turn this potential crisis into a way to actually strengthen your practice. Let's dive in. So let's be really clear here. This isn't about politics. It's about payroll, it's about payments, and it's about patient care. A shutdown directly messes with your revenue cycle and your operational stability. So the real question is, have you built the financial firewall you need to protect your practice and, of course, your patients? All right, here's our game plan. We're going to start by really defining the challenge and the immediate financial and operational threats that come with it. Then, we'll get into an actionable playbook that's designed to build some lasting resilience. Let's get started. So, what really happens on day one? You know, a government shutdown isn't some distant event happening somewhere else. It's an immediate shock to your system. It's that unexpected payment delay, the regulatory question that goes unanswered, that sudden halt in a process you count on every single day. Think of it like a shock wave, right? What starts in Washington, D.C. immediately complicates your revenue cycle. It leaves critical regulatory questions just hanging in the air, and it really puts your ability to deliver seamless patient care to the test. Now, let's get really specific about the financial threat. This isn't some vague risk. It's a ticking clock with very clear escalation points that every single practice leader needs to understand. The countdown begins on day one. The administrative slowdown? Well, it starts right at the top. At the Centers for Medicare and Medicaid Services, CMS, nearly half the staff, 49%, are furloughed. That's not just a small reduction. It's a near total shutdown of their support services, and it turns simple queries into major roadblocks for practices all over the country. And here's what that actually means for you. With half the staff gone, critical functions just grinds to a halt. You can forget about new provider enrollment or routine audits. Even simple stuff like benefit verification becomes almost impossible. Your admin staff is basically flying blind. And that administrative slowdown, well, it quickly turns into a cash flow crisis. In the first 10 business days you get a hold on new Medicare claims, it's a slowdown, sure, but it's probably manageable. The real danger is the 30-day cliff. After just 1 month, the contractors who process Medicare payments could literally run out of money, stopping all fee-for-service payments cold. This is where a headache turns into a potential financial hemorrhage. Now, beyond the payment delays, there's a kind of hidden operational landmine. Shutdowns often happen right when other critical healthcare provisions expire, creating something known as the extender cliff. And this is an event that can force you to redesign your clinical workflows practically overnight. Telehealth is the perfect and most dramatic example. Just look at how those pandemic-era flexibilities can just vanish. Suddenly, a patient's home might not be an eligible site anymore. Those audio-only calls, no longer reimbursed. And therapists like OTs and PTs could be completely cut off from providing telehealth to their Medicare patients. This isn't just a billing headache. It's a direct disruption to patient care and a sudden operational scramble for your whole team. Okay, so we've laid out all the risks. Now let's build the defense. This is not a storm you just sit back and endure. With a clear, actionable playbook, you can actively manage this risk and protect your practice's future. So the first part of that playbook is all about financial fortification. There are 3 essential steps here. 1, stress test your finances. You need to model what a 30, 60, or even a 90-day delay in Medicare payments would actually look like. 2, use that model to build up adequate cash reserves. And 3, and this is crucial, secure or expand your business line of credit before a shutdown is even on the horizon. Now, while you're fortifying your finances, you also have to accelerate cash flow from your non-federal revenue streams. What does that mean? It means stepping up collection efforts with your commercial payers and private pay patients. Make it easier for patients to pay you quickly, promote those online portals, and automate your invoicing to make the whole process way more efficient. Next up, you've got to strategically manage your own expenses. The best way to do this is to divide your payables into 2 buckets, critical and non-critical. You have to conserve cash for the absolute essentials, things like payroll and rent. For everything else, from office upgrades to marketing campaigns, start having proactive conversations with your vendors now. Ask them about flexible payment terms to preserve your liquidity. All of these steps, they all lead to one ultimate goal. See, this isn't just about surviving a shutdown. It's about using this challenge to test your own strategic foresight and to build a fundamentally stronger, more resilient practice for the long haul. I think this quote just perfectly captures the mindset you need.
A shutdown isn't a passive event you just have to endure. It is a fundamental shift in your operating environment, and it absolutely demands an active and agile response from leadership. Proactive management is the only way through this.
This right here, this is the shift in mindset that makes all the difference. When you approach a shutdown with strategic foresight, all that uncertainty gets transformed. It actually becomes a catalyst, an opportunity to stress test your systems, to strengthen your finances, and to build a more durable organization for the future. So I'll leave you with this question to think about for your own practice. With the right contingency plans in place, you can make sure that political gridlock never compromises your financial stability or your patient care. So, will this be a crisis, or will you make it a catalyst? The choice really is yours.